guys, it is Dr. G. I am here with a prediction, right? So, right now, and for the longest time, we've been trying to get the warning label changed on the testosterone medication. So, as it stands, there is a warning label that says men who have a history of prostate cancer are not allowed to have or should not have testosterone therapy. That is not true. If you have metastatic, meaning left the area, left the prostate, if you have metastatic prostate cancer, you shouldn't have testosterone therapy. It's a problem for metastatic. The other concern is that testosterone therapy increased the risk of cardiovascular events and stroke. That is not true. The Traverse study showed us that. So we've been lobbying to try to get the label changed so that more physicians feel comfortable in evaluating and treating hypogonadism in men. There's always an issue with maybe insurance covering or not covering, but honestly, the cash price for testosterone therapy is not that bad compared to the quality of life it will give you. My prediction is that when the label changes, now all of a sudden there's going to be a shortage on testosterone. So let's be on the lookout for that. But thankfully, there are compounding pharmacies that can make the testosterone. So my prediction is that testosterone is going to soon be in shortage, and that's fine. We can deal with that. But I am looking forward to the day that the label changes so that more physicians, more providers feel more comfortable in learning and diagnosing hypogonadism and treating these men. If you're a guy who's above the age of 35. It doesn't exclude you if you're below. I do have quite a few men who are in their 20s. But above the age of 35 is when we start seeing low mood, low energy, holding on to fat, inability to gain muscle despite eating well and working out, doing the strength training. Libido is usually the last on the list, and I see thousands of people. Okay, like libido is generally one of the last complaints. It's usually endurance. I can't keep up with my kids the way I used to. I work out and I feel like I'm not gaining muscle. I'm holding on to this spare tire and I can't get rid of it. So there's so many things that come before libido. So don't let your masculinity even come into thought on that one. But work with a provider that is proficient in checking the labs, diagnosing hypogonadism, and treating it properly. And I hate for my guys to walk around subpar when we can give you a better quality of life. So that is my rant today.